Let's talk about the CDC, a name that's become synonymous with public health in America. This is the agency we rely on for guidance during health crises, the organization that sets the standard for disease prevention and response. For decades, the CDC has been the gold standard, trusted by doctors, scientists, and the public alike to provide clear, science-based recommendations. But now that trust is being shaken to its core. The agency is facing a crisis unlike any in its history. The reason? Robert F. Kennedy Jr. has been appointed Health Secretary, a man whose public stance against vaccines is well known and deeply controversial. Since taking over, Kennedy has gutted the CDC, slashing budgets, removing key staff, and turning what was supposed to be reform into utter chaos. The agency is teetering on collapse, not from minor tweaks or policy changes, but from a full-scale assault on its very mission and values. Instead of learning from past mistakes and building a stronger future, we're witnessing a systematic dismantling of America's public health defense system. The irony is hard to ignore. Kennedy was brought in to reform the CDC after its COVID-19 missteps, but instead, he's driving it toward disaster. This isn't just about politics or personalities, it's about whether we'll have a functioning CDC when the next pandemic inevitably strikes. Pandemics don't care about politics, ideology, or who's in charge. They move fast and they hit hard. And right now, our main line of defense, the CDC, is being sabotaged from within, leaving us more vulnerable than ever. The question is, can the CDC survive this storm, or are we watching the unraveling of America's public health safety net? Let's break down the damage and see what's really happening behind the headlines. In just 6 months, thousands of CDC scientists and experts have left. A mass exodus of talent and experience that took decades to build. The agency's budget? Slashed in half. That's not just a cut, it's a crippling blow that leaves critical programs gasping for air. Labs, disease surveillance, and local health support are all on life support, barely able to function as resources dry up. Even worse, the CDC has lost control over vaccine policy, Kennedy's pet issue, replacing science with politics and putting public health at risk. The result? A vacuum where expertise used to be, now filled with confusion, rumors, and misinformation spreading faster than ever. Dr. Ashish Jha summed it up. Kennedy isn't reforming the CDC, he's breaking it piece by piece with consequences that will last for years. The agency is being hollowed out, stripped of its ability to protect us from outbreaks, disasters, and the next big threat. This isn't a renovation, it's a demolition, tearing down the very foundation of our public health defenses. America's immune system is being dismantled piece by piece, leaving us more vulnerable than ever before. And the most alarming part? No one in charge seems interested in stopping it, or even sounding the alarm. The chaos deepened last week, sending shockwaves through the entire public health community and leaving staffers reeling. That's when Kennedy fired the CDC's new director, publicly and without warning, in a move that stunned even seasoned political observers. 4 senior leaders immediately resigned in protest, triggering a mass exodus of the agency's top brass and leaving gaping holes in its leadership structure. These aren't minor players. They're the experts who have been steering the ship through countless crises, the very people relied upon for guidance in emergencies. Their abrupt departure is a blaring alarm. The CDC is now seen by many as unsalvageable under the current leadership, with morale at an all-time low. Dr. Dimitra Daskalakis, head of respiratory diseases, warned in his resignation letter that the agency's heart rhythm is not viable, painting a dire picture of internal dysfunction. The CDC is paralyzed. No stable leadership, no clear direction, just fear, uncertainty, and chaos echoing through its empty halls. Who would want to step up and lead now? For most, it's a career death sentence, a risk few are willing to take. The agency is rudderless, adrift in a storm, and the only voice left is the one that started this mess in the first place. The top floor is now an echo chamber, haunted by the absence of leadership and the uncertainty of what comes next. What do outside experts say? It's bleak. The CDC is described as badly wounded and losing legitimacy fast. If doctors and the public don't trust CDC guidance, the whole system collapses. Imagine a new virus emerges, but no one listens to CDC warnings because the agency is now a political punchline. Trust built over decades is vanishing in months. Yes, the CDC stumbled during COVID-19, but Kennedy's actions have made things exponentially worse. He's taken a treatable patient and delivered a lethal blow. Former officials are horrified, watching decades of progress erased for political points. America's immune system is being deliberately weakened by its own leadership. This isn't just a tragedy for CDC staff, it's a disaster for all Americans. Is there hope? Maybe, but only with a total reversal. The CDC needs its budget restored, scientific staff rehired, and vaccine policy returned to independent experts. Science must be free from political interference. The agency must regain public trust through transparency and honest communication. It's not about quick fixes, it's about rebuilding credibility, one step at a time. The CDC's survival depends on leadership that values evidence over ideology. The foundation is strong enough to rebuild, but only if the demolition stops now. Because the next pandemic isn't a matter of if, but when, and we need a functioning CDC when it comes.